Hi guys, my name is Katie and today we're going to be discussing traumatic brain injury, or TBI for short. So what exactly is traumatic brain injury? Traumatic brain injury, TBI, is defined as a disruption in the normal function of the brain that can be caused by a bump, a blow, or a jolt on the head, or in other words, it's just a penetrating head injury. Some statistics on traumatic brain injury found from CDC states that every year, TBI contributes to a substantial number of deaths and cases of permanent disability. In 2010, 2.5 million TBIs occurred either as an isolated injury or acting along with other injuries. In 2014, there were approximately 2.87 million TBI EDHDs in the United States. Now, EDHD stands for emergency department visits, hospitalization, and death. Looking at the graph from 2006 to 2014, the numbers have increased tremendously. About 2.52 million were emergency department visits, 288,000 TBI patients were hospitalized, and 56,800 patients resulted in death. This increased from 53% from 2006 to 2014. What causes traumatic brain injury? As stated before, it's blows or other traumatic injury to the head or the body. This includes falls, vehicle-related collisions, violence, sport injuries, explosive blasts or other combat injuries, and intentional self-harm. Looking at the graph, it shows that falls is the biggest portion of traumatic brain injuries at 40.5%. Traumatic brain injury varies in severity. There's 3 different types: mild, moderate, and severe. Mild is caused by a blow to the head or violent shaking that temporarily causes TBI and impaired cognitive ability. Mild TBI is more like a concussion. It's categorized by a score ranging from 13 to 15 on the Glasgow Coma Scale. Moderate TBI is consciousness is often lost for a significant amount of time, varying from several minutes to several hours, and the post-injury recovery may last for several months. Depending on the case, full recovery may not be possible. Moderate TBI is characterized by a scoring range between 8 to 13 on the Glasgow Coma Scale. Now, severe traumatic brain injury is characterized by comatosis, or being in a coma, and it's often permanent brain damage. Death may occur in extreme cases. Severe TBI is characterized by a score ranging between 8 or lower on the Glasgow Coma Scale. The Glasgow Coma Scale is used to determine the severity of the traumatic brain injury. Basically, medical professionals determine the response and then add the corresponding value to each response. So they looked at visual response, verbal response, and motor response. They add it up and determine whether it's mild, moderate, or severe. Some signs and symptoms from mild traumatic brain injury: there's fatigue, headaches, light sensitivity, dizziness and balance problems, irritability, depression and mood swings, nausea, and general confusion and mental fog. For moderate traumatic brain injury, some of the mild symptoms still occur. However, there's also strong recurring headaches, amnesia or memory loss, fluids draining from the ears and the nose, dilation of pupils, seizures, and slurring of speech. For severe traumatic brain injury, there's a lot more signs and symptoms. They include difficulty coordinating balance, blurred vision or one or both eyes, mild vision problems, seizures, changes in sensory perception, trouble speaking and swallowing, changes in sleep patterns, lack of bowel or bladder control, changes in sexual function, motor impairment, difficulty forming sentences, trouble communicating, difficulty with reason and logic, memory impairments, poor concentration, and limited attention span. The diagnosis for TBI. First, the physician will ask questions like, how did it occur? Did they lose consciousness, and for how long? They're just trying to understand the situation and how the TBI could have occurred. There's imaging tests that physicians will do. First, the computerized tomography CT scan. It's performed in the emergency room when they suspect a TBI. It uses a series of x-rays to create a detailed view of the brain. This will visualize fractures and uncover any evidence of bleeding, from a hemorrhage, blood clots as hematomas, bruised brain tissues, contusions, and brain tissue swelling. They also use MRIs or magnetic resonance imaging, and this uses powerful radio waves and magnets to create a detailed view of the brain. This is used after conditions stabilize or if they do not improve. There's also an intracranial pressure monitor, and this is when the tissue swelling from TBI injury can increase the pressure inside the skull and cause additional damage to the brain. This will show if the doctors need to insert a probe to the skull to monitor the pressure and if they need to release it. The treatment and care for traumatic brain injury differs between the severity. For mild injury, there's really usually no treatment other than just resting and over-the-counter pain relievers to treat the headaches that you may have. It should be monitored closely at home for worsening symptoms. Immediate emergency care is very important for traumatic brain injuries. Emergency care for moderate or severe TBI focuses on making sure if the person has enough oxygen and adequate blood supply going to the brain, if they're maintaining blood pressure, and to prevent any further injury. Additional treatment may be needed to focus on secondary damage due to inflammation, bleeding, and reduced oxygen supply to the brain. Some medications that may be used for traumatic brain injuries include diuretics, anti-seizure drugs, and coma-inducing drugs. Diuretics reduce the amount of fluid in the tissues and increases urine output. This helps reduce the pressure inside of the brain. Anti-seizure drugs, they're used for people who have moderate to severe TBI and who are at risk for having seizures during the first week or so after their injury. It avoids additional brain damage that might be caused by some seizures. Coma-inducing drugs are used for severe cases where doctors have to temporarily place the patient in a comatose state because in this state, the brain needs less oxygen to function. This is helpful for blood vessels when they're compressed by increasing pressure in the brain and are unable to supply the brain cells with normal amounts of nutrients and oxygen. If medication doesn't work, there's also a surgery and rehab specialist that these patients will need to go to. If it's severe enough, some surgeries that may occur are removing blood clots, repairing skull fractures, repairing bleeding in the brain or making it stop, and opening a window in the skull to release some pressure. Rehab specialists that these patients may need to see are psychiatrists, occupational therapists, physical therapists, speech and language pathologists, neuropsychologists, social worker or case managers, rehab nurses, TBI nurse specialists, recreational therapists, and vocational counselors. In a case study, there's a 28-year-old white male who lost control of a motorcycle and was found unconscious in a prone position without wearing a helmet. He has severe traumatic brain injury. He was found in a bradycardic state with his lowest heart rate being 28 beats per minute. He was also hypertensive when he was found. His initial blood pressure was 172 over 118 millimeters of mercury, but it also elevated to 221 over 102 millimeters of mercury. He had 4 millimeters bilaterally fixed pupils, negative cornea response, and right parietal cephalohematoma and cerebral spinal fluid on the right side of his brain. Each day post-op, this male improved in function. He experienced complications but overcame them with other procedures. 3 months after multiple operations, he now lives with his mother and required permanent aid for his activities of daily living. He required speech pathologists, OT, PT, and other rehabilitation care. After 1 year of treatment, he can now live at home and do the IADLs and ADLs, which can be living at home by himself, interacting with others, shopping, walking, feeding himself. This individual can do exercise. The exercise prescription for traumatic brain injury for aerobic activity includes 3 to 5 days per week. You want to work up to 5 days. The intensity can be from moderate to high intensity, but you want to start lower and gradually increase. You want to try to work out for 20 to 60 minutes total, but these workouts can be separated for about 3 20-minute bouts of exercise. And the type of activity that this individual can do includes walking, running, biking, swimming, rowing, and aerobic classes. you really want to try to work on low impact exercises that will incorporate all the large muscle groups. An exercise prescription for resistance training for those who have traumatic brain injury should be about 2 to 3 days per week, and you want to work at each major muscle group. It should be noted that you should have at least a minimum of 48 hours of rest between training sessions working the same muscles. When you're doing resistance training, you want to do about 3 sets of 8 to 12 reps. You want to start with 1 set and then again gradually work up to 3 sets. And the type of activity that you can be doing is body weight, TRX, free weights, circuit machines, kettlebell swings, and resistance bands. Now you want to start using machines or resistance band or even body weight exercises until you improve in coordination so that you can do free weights. This will reduce the risk of falls and further injury. An exercise prescription for flexibility in those who have traumatic brain injury is very important. The effects of the brain injury include reduced range of motion, stiffness, spasticity, ataxia, and reduced tone. This causes flexibility exercises to be difficult to perform, so doing flexibility will improve the tightness and spasticity. Spasticity is the uncontrolled tightening or the increased muscle tone caused by the disrupted signal from the brain, and this is very common in those who have TBI. For flexibility training, you should do it as often as possible every day. It's recommended to stretch in the morning, after a workout, and before bed. The intensity of the stretch should be until it's a point of tightness, but no pain. You should hold each stretch for about 10 to 30 seconds, but you want to aim for the 30-second mark. And the type of flexibility training that you want to do is slow static stretches. Exercise prescription for balance training for those who have traumatic brain injury is also important because this will improve coordination, agility, muscular strength, and this will all reduce the risk of fall or the fear of falling for those who have TBI. The frequency of balance training should be a minimum of 2 to 3 days per week. The intensity isn't established yet. However, you should try to do 60 minutes total, and that can be intermittent. You can split it up between several 20 to 30 minutes each day. You can do yoga, Pilates, Tai Chi, standing on one leg, heel-to-toe walk, standing on an unstable surface such as a Bosu ball or a wobble board. And the citations for this research was found from the CDC, Mayo Clinic, and shepherd.org.